Hi everyone, so in this video I would like to talk about the role of hereditary in developing colorectal cancer in young adults, in which the incidence has been increasing over the last 4 decades. And the increase of this malignancy in young adults has really been global, and by 2030 it's expected that the incidence of colorectal cancer in young adults will increase by more than 140%. And unfortunately we still don't know why the incidence of colorectal cancer in young adults is increasing. However, we know that around 30% of young adults with colorectal cancer have at least one first-degree relative with colorectal cancer, and up to 25% of the cases have mutations in one of the cancer predisposing genes. So they were born with mutations that increase the risk of developing colorectal cancer. And those with mutations in one of the cancer predisposing genes, many of them have what's called Lynch syndrome, which is hereditary syndrome associated with a germline variant in one of the genes related to mismatch repair pathway, and those are MLH1, MSH2, MSH6, PMS2, or IPCAM. It's really worth mentioning though, those patients who have mutation in at least one of the cancer predisposing genes, around half of them don't have family history with colorectal cancer, and this suggests that family history and phenotype have limitations for the genetic risk predictions. Therefore, according to the Collaborative Group of Americans on Inherited Gastrointestinal Cancer, multi-gene cancer panel testing should be considered for all young adults with colorectal cancer, regardless of the age and regardless of the family history. And a part of the genes that are associated with Lynch syndrome, at least 6 other genes should be included in the panel, and those are APC, MUTYH, SMAT4, BMPR1A, P10, and STK11. And this is really imperative, because if we don't consider multi-gene cancer panel testing for all young adults with colorectal cancer, we might miss a significant proportion of these patients who might have hereditary colorectal cancer syndrome. And identifying these genetic risk factors is fundamental for the clinical management of patients and their family members. So when we know there is a hereditary syndrome running in the family, the patients and their family members should undergo colorectal cancer screening at the earlier age based on the guidelines, and should consider genetic counseling. And by doing this, we can prevent colorectal cancer development in the family members, and we can decrease the incidence of colorectal cancer in young adults.